shortly in a minute. But before we jump into today's topic, and we'll cover an overview here, I'd like to give you a little bit of a background on SESCO. SESCO was founded in 1945. We are the oldest human resources consulting firm in the country, and we service clients in all 50 states and all industries, including state and national trade associations. We have a variety of ways that we serve our clients, whether that be through monthly service agreements and or billable projects. So before we end our time together, we'll make sure that we give you some additional information on how to contact SESCO if you need ongoing support, and just a little bit about what we've been doing over the last 2 weeks. Obviously, it's been a very busy time in our office, and we processed well over 1,500 client cases concerning the Families First Coronavirus Response Act, as well as the CARES Act in just the last 2 weeks. Volume of telephone calls and emails that we have had from our valued clients. So we do appreciate you taking time out of your busy day to join us this morning, and know that the information that we will be presenting can also be found on the SESCO website, and we'll cover that as well before our time ends. But we will also be able to blast out the recording or provide it for those clients or members of associations who were unable to join us. So let's talk about what we're going to cover this morning, and then I will introduce Lyle formally. Lyle is going to be going through the overview of the Families First Coronavirus Response Act, the FFCRA, to include the 2 provisions underneath that act, which would be the Emergency Paid Sick Leave, as well as the Emergency Family Medical Leave Expansion Act. And as you can imagine, those 2 are driving a lot of questions, a lot of confusion, and there's a lot of information out there. So hopefully Lyle will break it down for you in a very succinct, clear manner to help you differentiate how do we really comply and what do we need to be providing for our employees. We'll talk about how they interact with other leave as well. Then we'll roll into the CARES Act and talk a little bit about the Paycheck Protection Program loan overview. And then we will round out with some questions. Now, if you have questions, please utilize the chat feature that you can find on the right-hand side of your screen. Those comments will come directly to me, and I will field those to Lyle at the end of our time. So with that being said, I'd like to introduce Lyle. He is a very, very valued member of our team. He is a senior consultant out of the corporate office. He does primary practice area in affirmative action, wage and hour compliance, compensation development, and serves as a generalist consultant in all areas. Lyle has been very instrumental in our COVID-19 task force and taking kind of a leadership role there, and has been analyzing all of the regulations, the changes, the interpretations that have come out, quite frankly, over the last 3 weeks, sometimes even daily, and what those changes have been. So Lyle today is going to present this information. And with that being said, welcome, Lyle. It's all yours.
Thank you, Jamie. I appreciate that. We'll go ahead and get started with the technical piece of the presentation today, and that would be the essentials of the Families First Coronavirus Response Act, and also touching on some of the CARES as well. Now, it's not lost on me that the technical parts of these sorts of presentations are not always the most exciting, but I think if we're honest, it's what brings us all together today. And our goal and our desire for this time is that it would not intimidate you all, that it would be a time that we could provide clarity to come alongside businesses and the business leaders, and provide clarity on new laws that can guide you through the trials of navigating this pandemic as an employer. We hope that you leave the webinar prepared to face the storms that are swirling about, and also hopeful for the greater days ahead. So without further ado, let's begin this section of the webinar. So the Families First Coronavirus Response Act, FFCRA, is the first piece of COVID-19 response legislation to substantially affect employers and their employees. It went into effect April 1st of 2020, which is 1 week ago today. And as many of you are probably aware, there are two pieces of normal FMLA, the employer coverage and the employee coverage. This is mirrored in the FFCRA, and so we have a standard for employer coverage, and that is that every private employer with fewer than 500 employees and certain public employers regardless of their size. Now that 500 or fewer is somewhat of a moving target. That is going to be at the time that the employee takes the leave, requests to take that leave. So there will be some ongoing calculations for those of you who are on the borderline of 500 or fewer. Now, there are some tests and some guidance that the Department of Labor has offered for us to try and figure out, do we have 500 or fewer, or do we have more than 500? The first test is the joint employer test that we see in the Fair Labor Standards Act, and that really helps us determine who is our employee, especially for shared employees if we have temporary employees or things similar to that. The second test is the integrated employer test that we find in the FMLA, and that is going to help us as we combine locations, divisions, and establishments to determine who all belongs under one employer. If you all need further help with those tests, I would encourage you to reach out to us and get in touch with us, and we will be happy to walk you through those and help you determine employer coverage. The second piece here is the employee coverage, and this is broken down between the two different components of the FFCRA. For the purposes of paid sick leave, all full-time and part-time employees will be eligible if they work for a covered employer. Now, for paid FMLA leave, those full-time and part-time employees who have been employed for 30 calendar days or more. Now, this is important to remember that this is a rolling eligibility. So even if you hire an employee today, after 30 calendar days, they will be eligible for this expansion to FMLA until this act expires. We would ask you to note, for those of you that are familiar with the provisions of normal or traditional FMLA, that the eligibility requirement, the 12 months, 1,250 hours, some of those other things, they do not apply to this expansion to FMLA for paid FMLA leave. Now, there are a couple of exceptions to the employee coverage that have been defined by the Department of Labor. The healthcare providing employee and the emergency responder employee may be excluded from coverage under FFCRA. The healthcare providers are defined as employees of doctors' offices, hospitals, nursing homes, retirement facilities, and other similar healthcare providers. If you all need some help determining if you meet the standards of healthcare provider, once again, please reach out to us and we can help you understand that. We also have the emergency responder. Generally, this is going to be for employees whose skills and services are needed for the response to the COVID-19 pandemic. Employees that may be military or National Guard members, firefighters, EMS workers, police officers, folks like that are clearly emergency responders, but also, you'll see on this list public works personnel. There's also a provision that the Department of Labor has defined that where a state official, the highest official in a state or territory, may define certain individuals, certain employees based on their skills if they are necessary for that state or territory's response to COVID-19. As such, we encourage you to monitor your state-specific communications for developments there if you think your employees and your industry could potentially be covered there. Once again, we're happy to help with that if we can. Now, both of these exceptions, it's important to remember that they may be accepted, that they not must be accepted. And that's an important distinction, and the Department of Labor really tried to highlight that for employers as they encourage employers to apply these exemptions judiciously. That way that it helps to help limit the spread of COVID-19. So let's talk about some of the qualifying reasons that an employee would be eligible to take emergency paid sick leave. Now, the standard for each of these is that the employee is unable to work or telework due to the need for leave for one of these 6 reasons. The first reason is quarantine. That is to comply with a federal, state, or local quarantine or isolation order related to COVID-19. We've been getting a lot of questions here lately as many of these states have implemented stay-at-home or shelter-in-place orders. And if an employee is unable to work due to one of those orders, then they may be eligible for emergency paid sick leave under number 1 as part of a quarantine. Number 2 is self-quarantine. That is for an employee to self-quarantine under the advisement of a healthcare provider due to COVID-19 related concerns. Those related concerns can be that the employee themselves has been diagnosed with COVID-19, potentially someone in their household has been diagnosed with COVID-19, or they could have some health conditions that put them at an elevated risk. The key to this reason is that the healthcare provider advises and recommends that they need to quarantine or isolate. The third reason is for diagnosis. This is for employees who are experiencing symptoms as defined by the CDC to seek medical diagnosis. Reason number 4 is to care for a quarantined individual. This is to care for an individual who is subject to a quarantine or isolation order similar to those under number 1 or number 2. Now, this is not to care for any individual. The standard here is for an employee's need to care for an individual for which there is a reasonable expectation of care based on their relationship. It's not just to care for anyone that an employee may happen to be acquainted with. There does need to be a relationship there. The 5th reason is for child care, to care for an employee's son or daughter if the school or place of care has been closed or the child care provider is unavailable because of COVID-19. And 6th, there is substantially similar care. This is to care for the employee's own substantially similar condition as specified by the Secretary of Health and Human Services. As of yet, there has not been a list published by the Secretary of Health and Human Services to serve under reason number 6. Make sure you stay tuned to our alerts. If we see something like that come up, we're going to try and forward that along to those that are subscribed to our alerts and our newsletters. So let's talk a little bit about what that phrase unable to work or telework has and what that means for employers and their employees. Now, unable to work or telework means that the employer has work and qualifying reason number 1 through 6 prevents the performance of that work. Unable to work or telework does not apply to employees who have been furloughed or laid off or their employer is shut down or closed due to a lack of work, due to one of these provisions of one of these state orders. They would not be covered because that employer has not made work available. The effect of a stay-at-home or shelter-in-place orders, we're seeing many businesses that have fallen under one of these essential business provisions of these orders. If that's the case, then the employee would not be unable to work due to that quarantine or isolation order, and we would need to look at a different qualifying reason for that employee to receive emergency paid sick leave. So the first thing that we need to determine once a covered employee has come to us and requested this leave is we need to determine how much leave they are eligible for. So first we'll talk about the non-child care related reasons. This qualifies the employee for FFCRA paid sick leave only, and that is the 2 weeks of paid sick leave under FFCRA. This is for qualifying reasons, numbers 1 through 4 and 6 that we just discussed. And for full-time employees, that means employees who work 40 hours or more, they will be eligible for up to 80 hours. For part-time employees, they will be eligible for 2 weeks worth of the normal hours they work in a week. Now, if your employees potentially do not have normal hours of work, if their hours vary, then we will need to make a calculation based on the number of average hours worked over the last 6 months. The bottom line to this is that the paid sick leave is capped at 80 hours over 2 work weeks. Now let's talk about the leave amount for the purposes of childcare. This covers FFCRA paid sick leave in addition to the expansion to FMLA for paid leave. This is qualifying reason number 5, that is to care for a child, a son or daughter whose school or child care provider is unavailable, or school or place of child care is closed. This will make the employee eligible for 2 weeks of paid sick leave and 10 weeks of paid FMLA leave, for a total of up to 12 weeks of paid leave at 40 hours per week for full-time employees, and up to 12 weeks of paid leave at the number of hours the employee normally works over that 12-week period. Once again, if the employee does not work a normal number of hours, their schedule varies, we will need to make that calculation over a 6-month period. One important note to make on the leave amount for the purposes of childcare is that the DOL has issued regulations that allow employers with 50 or fewer employees to claim an exemption from leave for the purposes of childcare when it would jeopardize the viability of the business as a going concern. Now, that could be interpreted several different ways, and so the Department of Labor has issued 3 tests, 3 protocols for employers to implement on themselves, and an employer who wishes to exercise this exemption will need to substantiate their claim to one of these 3 tests. The first is that business expenses and financial obligations would exceed the available revenue of the business. Second, that an employee's absence would entail a substantial risk to the financial health or operational capabilities of the business. Generally, that's due to specialized skills or other components of that employee's specific job. And third, no sufficient substitute workers to perform the labor or service of the employee requesting leave are available. Generally speaking, we would encourage you to apply this exemption conservatively. We think that these 3 tests set a relatively high threshold for employers to meet to exempt themselves from offering this paid leave under FFCRA for the purposes of childcare. After we've calculated the leave amount, then we need to calculate how much we need to pay employees for this paid leave benefit that they're receiving. This is broken down into a couple of different categories. The first category is for reasons numbers 1 through 3. That is, federal, state, local government, or a healthcare provider issued quarantine or isolation order, as we discussed earlier, or the employee is experiencing those symptoms as defined by the CDC and seeking diagnosis for COVID-19. If the employee qualifies for leave under one of those 3 reasons, they are eligible to receive 100% full pay at the greater rate of their FLSA regular rate of pay or the applicable minimum wage. I will remind you that the FLSA regular rate of pay is all of an employee's earnings divided by the number of hours that they work. This includes commissions, bonuses, etc. This pay is capped at up to $511 per day and $5,110 in the aggregate over the 2-week period. The pay amount for reason number 4 and reason number 6, that is the care for an individual subject to a quarantine or isolation order, or the employee's substantially similar condition, those employees will be eligible for pay at 2/3 their FLSA regular rate of pay or the applicable minimum wage. The cap here is $200 per day and up to $2,000 in the aggregate over the 2-week period. And that brings us to pay amount for reason number 5, that is care for a child whose school or place of care is closed or the child care provider is unavailable. These employees will be eligible for 2/3 the pay at the greater rate of their FLSA regular rate of pay or the applicable minimum wage. Once again, the cap is at $200 per day. However, because there is an expanded 12-week leave window, there's a $12,000 cap on the aggregate of this. That is $2,000 for the 2 weeks of FFCRA paid sick leave and $10,000 for the 10 weeks of paid family and medical leave. There are a couple of additional provisions that we would like to discuss on the paid sick leave under FFCRA. That is that employers are not required to cash out this paid leave upon separation of employment. There is not a carryover from year to year. As it stands right now, the act is set to sunset on December 31st, 2020. Any unused leave that an employee does not take of this paid sick leave benefit does not carry over beyond that date into 2021. For the leave sequencing, if you provide your employees with paid leave, the employees may use the paid FFCRA sick leave first before they use other available leave. The employer cannot require an employee to use other accrued unused paid leave before the use of FFCRA paid sick leave for a qualifying reason. Intermittent leave is only allowed for reason number 5 for paid sick leave, and that is only with an employer agreement. So that's important to understand, that intermittent leave is not required of employers, but if you wish to reach an agreement with your employees for intermittent use of paid sick leave, it is only for the purposes of reason number 5. Some more provisions for the expansion to FMLA leave include that employees may elect to use other available paid leave to cover any unpaid portion of FFCRA FMLA leave. Employers cannot require those employees to use other available paid leave except in rare cases. Those rare cases are only when the expansion to FMLA leave is unpaid. I would recommend that you consult your own FMLA policies in addition to SESCO before you implement a policy of using other available paid leave for the purposes of FFCRA FMLA leave. The employee may choose to use other paid leave to supplement that 2/3 pay that they would receive during the expansion to FMLA to bring them up to the total of 100% of their normal pay. Intermittent leave is permitted in certain circumstances, but it is not required. Once again, it is only with an employer agreement. Generally speaking, we recommend against using intermittent leave because it will produce a significant administrative burden on your HR systems and resources. But in some certain situations, it could be the best option, and we'd be happy to walk you through that. Similar to normal FMLA leave, there are job protection and restoration components of the expansion to FMLA leave. Employees must be returned to the same or an equivalent position upon their return to work from FFCRA paid FMLA leave. There is an exception for employers with fewer than 25 employees if these requirements are met. The position of this employee must have been eliminated due to economic conditions resulting from the COVID-19 pandemic. Employers must make reasonable efforts to restore that employee's position, and that includes making contact with the employee if an equivalent position becomes available within that year. So how does FFCRA paid leave interact with some of these other paid leaves that employees may have? It is above and beyond, in addition to all current paid leave available to the employee. This includes existing state or local paid sick leave, as well as employer-provided paid leave. There are no existing paid leaves that may fulfill the requirements for paid leave under FFCRA. Now, this is one of the interesting components of this paid leave and something that employers certainly want to take note of. There is a tax credit available that is a 100% dollar-for-dollar reimbursement to employers for all qualifying wages paid to employees under FFCRA paid leaves. These tax credits are also available to cover and maintain an employee's health insurance coverage with the employer's premiums. Now, this does require close administration to receive those tax credits. We recommend that you are well acquainted with the qualifying reasons or know someone who is, so that you can make sure that employees are in fact qualified to receive this leave, so that as your employer and the business will receive those tax credits. For further information on tax credits, we would encourage you to consult your accountant or other tax professional for more information to make sure that you have what you need to get those tax credits. The documentation requirements have been issued from the Department of Labor and the IRS, obviously governing those tax credits. Those include the employee's name, the dates for which the leave is requested, the qualifying reason for leave, a statement that the employee is unable to work because of the qualifying reason for leave, and other supporting documentation for that qualifying reason. And I believe Jamie's going to demonstrate for you guys in just a little bit some of the resources that are available on SESCO's website and our COVID-19 employer toolkit. One of those resources that we have available is a template that you all can use to maintain this documentation and to get certification from the employee to the qualifying reason for this leave. These documents, employers should maintain those for 4 years. Some of you may be wondering about what sorts of supporting documentation may you ask for, may be required. And on those pieces, an example would be if a school or place of care has closed, then an employer could provide the name of that school, the name of their child, in addition to a copy of that notice that they received that school was closed. If they qualify under a healthcare provider's order, then they could provide that healthcare provider's name as supporting documentation for their qualification for this leave. There are some notice requirements for employers to make their employees aware of what leave may be available to them. Covered employers are required to post a notice informing employees of their right to leave. Once again, in our employer toolkit, you can find a model notice there that you may post and fulfill your requirements. This must be posted in a conspicuous place on the employer's premises, generally where you might post other employment law notices that you're required to keep. A couple of final notes on the applicability of the FFCRA to employers and their employees. The paid leave is not available to employees solely due to business decisions or operational closure. The qualifying reason must prevent the employee from performing work made available by the employer. That means if your business is shut down due to economic reasons or due to one of these shutdown or shelter-in-place orders, then your employees would not be eligible for paid sick leave under FFCRA. FFCRA is only available to those employees who meet the qualifying conditions. Once again, just to be clear, the effective date for the FFCRA paid leave provisions is April 1st of 2020. That is 1 week ago as of today. And the sunset for these provisions as it stands right now is December 31st of 2020. Now, I've seen in the comments section, some of you have been asking about this, and I know that it's a topic that many of you are wondering about and evaluating. And so we want to provide a little bit of information on the CARES Act and some of the different provisions to employers under the CARES Act. Just a quick overview. This was enacted on March 27th of 2020. Quick note on some of the changes to FFCRA that were included in the CARES Act. Under the expansion to FMLA leave, they did sort of redefine the employee eligibility upon rehire. And what they said was for those employees who were terminated after March 1st, if they had worked 30 of the previous 60 calendar days, they would be eligible for the expansion to FMLA leave upon their rehire. They also provided some technical corrections that we won't get into here, as they didn't materially change the act. Also under the CARES Act, there are small business loan programs, the Paycheck Protection loan programs, and similar programs. These generally have a loan forgiveness option, which is what makes them quite appealing to employers. There are also some tax provisions for businesses and the expansions to unemployment and pandemic unemployment assistance that came under the CARES Act. Just to briefly touch on an overview of those Paycheck Protection Program loans, those are administered by the SBA. They are generally low interest loans for small businesses, for qualified employers. They relax the lending requirements versus what you may be familiar with normal SBA 7A loans. And they offer this provision for principal forgiveness. And that forgiveness amount is the amount spent by the employer on payroll costs and other covered expenses during the covered period, which is generally that 8-week period following the origination of the loan. There are some reductions to the amount of forgiveness. There are ways that an employer could reduce the amount eligible for forgiveness, and one of those is a reduction in the average number of full-time equivalent employees per month during that covered period, or a reduction in an employee's wages greater than 25%. Both of those reductions will result in a reduction to the amount of forgiveness that a business would be eligible for. And generally, our advice to employers on this is that these decisions on whether you should take a Paycheck Protection Program loan or whether you should not are all highly individualized business decisions. They require weighing multiple factors, forecasting for your business and what you think it will look like going into the remainder of 2020, and also some degree of that entrepreneurial risk that drives American business and the American economy. So we're happy to help advise you on the overview, but once again, this is going to be an individualized business decision. With that, I will turn it back over to Jamie Hasty to bring us through the questions section and also wrap up and conclude the program. Thank you all.
Thanks, Lyle. And I very much appreciate your very thorough, in-depth review. And I see a lot of live comments. I see some participants actually responding to some of the questions in the live comments. So I appreciate your activity there. That SESCO will go through and field these comments from one of our actual consulting team members. So the first question, Lyle, is, in the PPP Act, do we have to pay at a rate of 100% the normal pay?
So that's a great question. And as long as the pay is not reduced greater than 25%, then you should not see a reduction in the amount of forgiveness. The amount of forgiveness will be reduced by reductions in pay greater than 25%.
Great. And the second part of that question is, if we pay our employees before the loan has been processed, can this amount be used to calculate the forgiveness?
So the forgiveness for the purposes of the PPP is for the amount spent for those qualifying costs, payroll costs, and some of those other expenses for the covered period, which is the 8 weeks beginning with the origination of that loan.
Wonderful. Thank you. Forrest Walker asks, where do funeral homes fall as it relates to the coverage exclusions?
That's a great question, and one that we've gotten from several different clients right now. Right now, we do not see an explicit exclusion for funeral homes. However, as I referenced with the potential for state leaders to define the emergency responder exclusion and those employees necessary for that, we believe there is potential there. Obviously, that'll be on a state-by-state basis, as are many of these things, since these orders are unique to the states.
Sure. Great. Gary asked about qualifying reason number 5, the child care provision. Is that really only for a single parent, or as long as you have a child whose school is closed, daycare is closed, the care provider is unable to care, that employee is eligible?
Well, that's a great question on eligibility for that leave. The way that the Department of Labor has phrased it, they call for the child care provider to be unavailable, and that you need to take the leave, you being the employee needs to take the leave to care for this child. If someone else is available to care for the child, then the Department of Labor has said that that is not going to be covered leave if someone else is available to care for the child. However, based on the documentation and certification requirements, it could be very difficult to really push your employees on this. If they're willing to certify that they have a true need to and they qualify because they need to care for their child, it can be very difficult to exclude them from this leave.
Sure, great. For emergency sick leave number 2, do we need a note from the doctor?
Generally, yes. That is only available for individuals who are self-quarantined or isolated due to the order of a doctor. If an individual just decides that they want to self-quarantine and they are not under the care of a healthcare provider, or they do not have an order to do so from a healthcare provider, then they would not be covered for the purposes of paid sick leave.
Sure. Richard states that he has 8 employees and wants to know if he's subject to the expanded FMLA provision.
So you would be subject because you have fewer than 500 employees. For the purposes of childcare, you could walk through and evaluate those 3 tests that we mentioned, whether you could exclude employees who are seeking leave for the purposes of childcare because it would jeopardize the viability of your business as a going concern.
Sure. One of my home health clients states that they have employees wanting to be laid off so that they can collect unemployment. If they get the Paycheck Protection Act, can we pay them and keep them off unemployment?
So the Paycheck Protection Program is designed, and that's the underlying principle, is that they're offering this program so that employers will keep their employees employed and on their payroll. I will say it can be difficult if employees are seeking layoff and those sorts of things. That has not been defined as far as maintaining your workforce, because they have not necessarily defined that employees who quit or need to be terminated for other reasons may be excluded from that reduction in the workforce. And so we're waiting further guidance on that.
Sure. Cindy states that she has an employee that was getting tested prior to April 1st when this act was officially in place. How do they pay them? Do you issue regular PTO?
So before this act went into effect on April 1st, you would follow your normal policies and procedures that would govern that leave. The provisions of the FFCRA are only in effect following April 1st. There are no retroactive provisions in the FFCRA.
Sure, sure. I have an auto body and restoration client that's asking if the business owner is quarantined, is he also eligible for this leave?
If the business owner is an employee of the business, as defined in the FFCRA, then I would say that you are eligible if you meet the qualifying reasons.
Great, great. One of our valued community health clients is asking if you could explain the difference between furlough and layoff.
Absolutely. So furlough, generally speaking, the employee would not have their employment separated. They would still be your employee. It would essentially become a leave of absence. That would be a furlough. A layoff, there is a separation of employment due to a lack of work or otherwise.
Great. So Jennifer asks, or states rather, that the employee's child daycare is closed, but they can work from home partially or intermittently, and then come into the office some. Can they use emergency paid sick leave for the intermittent?
So they may, that is the only paid sick leave qualifying reason that may be used intermittently is for child care. But once again, that's up to an agreement between the employer and the employee of how that will be implemented. The important thing to remember is that it can only be for times that the employee is unable to work or telework due to the need for child care.
Sure, sure. Well, I've got a couple of questions here from clients that are stating they're under that 50 threshold. How do they apply for the exemption if they need it for that small business piece? Can you speak a little to that?
There is not an application for these small employers. You don't need to send anything to the Department of Labor. What you will need to do is you'll need to maintain some documentation of how you evaluated the business and determine that you met one of those 3 tests. And you could produce that if a wage and hour investigator or someone similar to that approached you and said, why are you not providing this paid leave for your employees? You could demonstrate to them how you met one of those tests for exemption.
Sure. Great. Great. Okay, let's see. What else do we have here? I have a client that's asking if the essential business decides to close 1 day per week with a stay-at-home order in the state. The employees are being mandated to use vacation for the day that the business is closed. Should the FFCRA be paid for that 1 day in lieu of the vacation?
Presumably, if you're closing down 1 day per week, that would generally be I would assume for economic reasons, and so that's how we'll address this question. Okay. If you're closing down and the employer could otherwise be open as an essential business, then those employees would not be eligible for paid sick leave under the FFCRA because work was not available and they were not unable to work due to a qualifying reason. They were unable to work because the employer did not have work available.
Great. Laura asked a fantastic question regarding short-term disability and how that's going to interplay with payment of wages under FMLA for the child care piece.
So the short-term disability and some of these other components, I think it's important to remember that FFCRA is a separate piece and a separate benefit from those. And so it's important to apply the provisions of FFCRA independent of that. And what I mean is that if an employee qualifies for FFCRA under one of those qualifying reasons, then they would be eligible for that leave. But if the short-term disability payments or the conditions of that are such that they do not qualify, then they would not qualify for paid leave under FFCRA.
Right, great. And Laura, to your point under the FMLA, remember the short-term disability is due to the employee's medical condition. So if we're talking about the expanded piece under the FMLA for the child care, short-term disability won't apply in that provision anyways. Diana asks if they were sick before April 1st, they're not covered under FFCRA, correct?
That's correct. There are no retroactive provisions in FFCRA. It just begins the effective date of April 1st.
Sure. Janelle asks, who pays for the 10 weeks of FMLA after the paid sick leave? We only have 14 employees, and therefore we do not normally have to comply with FMLA. And any time that they would have taken off was under normal paid leave provisions per the employee handbook.
Right. So for an employer in your case, those paid sick leave and the paid FMLA leave under FFCRA are eligible for those tax credit reimbursements on the back end, but the employer will pay those on the front end.
Sure. Diana states that she has an employee who was sick, took the paid leave or the FFCRA leave for 2 days, but they were diagnosed with another medical condition, not COVID-19. Do they still need to pay under the FFCRA, or do they just cover the whole time as paid leave, general paid leave?
So for the purposes of that, if the employee was experiencing symptoms of COVID-19 as defined by the CDC, and they were seeking a diagnosis and tested for COVID-19, then that would qualify them for paid leave, for paid sick leave under the FFCRA. That leave would qualify, but only if they were seeking that diagnosis. And once that qualifying reason ends, so does paid sick leave. And they still have the remainder of the 80 hours or whatever their leave entitlement was available to them should another qualifying reason present itself.
Sure. Awesome. We also have questions about furloughed employees and unemployment. How do we know if our state will allow a furloughed employee to claim unemployment?
That's a great question, one that we've been getting a lot. Each state administers their own unemployment benefits. And so that's going to be a question for your state unemployment agency and the folks that administer that program. That's not something that we're going to be able to speak to.
Sure, great. Heather asks, if somebody is using the FFCRA for the 80 hours for reasons number 1 through 3, and then needs additional time off, would regular FMLA rules apply?
Potentially, regular FMLA rules could apply for those conditions 1 through 3, but only mainly if the employee actually has COVID-19 or a serious health condition as defined by FMLA, normal FMLA.
Sure, great. Another question, Lyle, is that I own or have multiple franchise restaurants. Do all locations have to close to not be responsible for the FFCRA pay, or just the employees at the one location that has chosen to close?
So only those that are subject to closure would not be covered by FFCRA. The key to remember on the inability to work, it has to be the qualifying reason that prevents the employee from working. If the business closes down, work is not available, then a qualifying reason is not what's preventing that employee from working. If the business is open and is providing work and the employee cannot perform that work due to a qualifying reason, then they are qualified for FFCRA paid sick leave.
Sure. A great question from one of our public school systems is, obviously schools are closed, the division is closed per a governor order. Does this mean that our employees are not eligible for this leave? They're requiring administrative staff to work and other contractual positions to work, but not certain positions like bus drivers.
Right, and so once again, we're going to fall back onto is the work available for that specific position. And for school systems, that it would also include telework, as many classrooms have moved online and to using other alternative methods of instruction. It's important for those employers to evaluate the employee's ability to work or telework if that work is provided.
Sure. Great. Let's see. We've got a couple more questions here. Ray states not an FFCRA question, but more regarding telework. Should we be requiring employees to log their time while working from home if we normally don't require a task tracking, just a normal timesheet?
So that is, the wage and hour concerns are certainly a little bit different with telework. If you have a non-exempt employee, an hourly employee, it is important that they track all hours worked remotely so that you can pay in compliance with the Fair Labor Standards Act.
Great. Let's see. Marilyn states that she has employees who have already applied for unemployment, but whose reasons for not working fall under the FFCRA. Do we pay them and they continue to receive unemployment?
So if they have a qualifying reason for FFCRA, then they would be eligible for that. Receiving unemployment is going to be something that's once again determined by the unemployment agency. Generally speaking, the employees who may be receiving unemployment would have to report the earnings that they received under FFCRA, and therefore they would see a reduction in their unemployment benefits, but that's going to be largely determined by the unemployment agency. I would encourage you to be very careful in your application of the qualifying reasons and make sure that they are unable to work or telework due to the qualifying reason if they've already qualified for unemployment. Great.
Glenda asks, if a person is out prior to April 1st, but it is a qualifying reason, and their timeout extends past April 1st, do we cover their leave from April 1st and forward?
That's correct. So if they have a qualifying reason that was in place on April 1st, then that employee would be eligible for, they would qualify for FFCRA paid sick leave after April 1st until that qualifying reason is no longer in effect.
Sure. Great question going back to the child care provision. In the instance of joint custody, who gets paid if they both stay home to care for the children, and how do we prove or disprove that they're actually staying home with their children?
That's a really great question, and it's one that we don't really have an awesome answer to. That the documentation piece is largely based on the employee's own certification and their own statement that they have a need to care for a child that is in accordance with FFCRA. And so there's not a lot of ways that the employer can push back to an employee who is willing to say, and potentially up to and including signing a statement that includes that they need to provide child care under this qualifying reason.
Sure. Great. We're getting short on time, so I'm going to try to field as many of these questions as we can before we kind of wrap up. Good question on taking leave intermittently. Does the full-time employee have to take 80 hours over 2 weeks? Or can they take it a couple of days at a time up to December 31st?
That's a great question on the intermittent leave. And for the purposes of the 80 hours, which is the paid sick leave, the intermittent can only be taken for reason number 5 for childcare. And the reason for that, as the Department of Labor has said, if one of those other qualifying reasons exists, we, especially for those that are working on site, you don't need to be going back and forth between either if you're quarantined yourself or if you're caring for a quarantined individual. That's not really an intermittent need. And so we see the intermittent can pop up for childcare or potentially for those that are teleworking. But once again, it's going to be up to the employer and the employee agreement to really drive that.
Sure. Okay, let's see. Oh, Debbie Scott asked a great question. Lyle, we've been getting this question for weeks. If an employee states the need to time off from work because they're scared that their spouse or family member will get sick, is this a qualification under the FFCRA?
That would only rise to the level of a qualification for paid sick leave under direct instruction of a healthcare provider. A healthcare provider would need to advise in that situation to bring that to a qualifying reason. Anything short of that, it would not qualify for paid leave under FFCRA.
Great. Okay. Angie asked, what options are available for employees who are experiencing significant pay decreases due to loss of business, even if we are an essential business, which may include the commissions and the hours generally worked?
So when we see reductions like that, potentially the employee could be eligible for some unemployment benefits, depending on how much work they have, the level of their compensation, et cetera. That's going to be driven by each state's unemployment agency. Beyond that, there are not a lot of options available to employers aside from, taking one of these paycheck protection program loans and just guaranteeing the money. There's not a lot of assistance left for partial folks beyond that unemployment benefit.
Sure. Okay, I'm going to do one last question. Do the employees need to officially request the emergency leave? And if so, how do they do that?
So an employee will need to request that. Once again, we have the template available for folks who are employees who are requesting that they'll need to get filled out. That should include the dates of expected leave, whether that's for childcare or whether that's for a quarantine order or something like that. But yes, the employee will need to elect to use these paid leave benefits.
Sure. Great. All right, Lyle, thank you so much. Again, you did a wonderful job. A lot of information, very in-depth knowledge of the regs. So we appreciate your time. We appreciate everybody that joined us and the really, really great questions that were coming in that we at SESCO were able to field for you. If we were unable to get to your question, and you are a current SESCO client or a member of an association that is a SESCO, that has access to SESCO rather, feel free to reach out to your consultant of record or contact us through the SESCO corporate telephone number at 423-764-4127. But briefly before we go, what I want to do is SESCO has a beautiful resource page on our website. Lyle, can you bring that up for us? If you go to SESCO, www.sescomgt.com, at the very top, you'll see this red banner titled COVID-19 Resources. And when you click that link, it brings you to this page. So Lyle's going to kind of slowly scroll down for it, but there is a wealth of information on this website, a 10-page employer FAQ document that's updated, complete overview of the FFCRA, general templates, samples, forms for layoff, manager talking points, infectious disease policies, all of the required employee leave request forms, the FFCRA poster, the expanded EFMLA forms, medical certifications, all of that is housed in the SESCO management website for you, or you can get that information also through your consultant. So if you have questions, I encourage you to reach out through the corporate telephone number or through your consultant of record. If we were unable to get to your question today due to time, I apologize for that, but we are more than happy to chat offline. So with that being said, thank you everybody for your time. Lyle, thank you for your time, and we hope everybody has a great day and stays safe.
Thank you, everyone.
Thanks.